I had a 17-year-old client come in today, female, who is experiencing low back pain. And the moment she walked in my door, I could tell you she was hypermobile. Her skin had a very velvety texture to it, and she just kind of seemed like, even though she's very athletic, she wasn't very comfortable in her own skin. And no one has ever even suggested to her that she's hypermobile. So one of my first questions to her was, who in your family is hypermobile? And mom says, well, I am. And my mom was even more hypermobile. And I said, okay, can you hold out your arm? And she held out her arm straight, and it literally like bent backwards, her elbow hyperextended. And I said, has it ever been suggested to you that you might be hypermobile? And she said, no, no one's ever said that. 6 months ago, this girl saw a PT for the same back pain. That PT gave her exercises that increased her back pain while she was doing them and told her, you just need to get stronger, keep doing them. That is not how we treat low back pain. I'm sorry, it's not. And the PT that she saw 6 months ago gave her very high level exercises that she could not have possibly completed with any kind of competence because she didn't know how to create a good abdominal brace. She was doing abdominal doming, where the abdomen, when you think about engaging it, pushes out instead of sucks in and pulls tight and makes your stomach look flat. And besides the fact that this girl has a very weak core, and yes, we need to work on strengthening it, she has significant weakness in the hip rotator muscles. And the clinical research since 2010 has shown unequivocally that hip rotator strength impacts low back pain, particularly when the sacroiliac joint is involved, and hers is definitely involved. But on top of that, when we're going through her assessment, I have one muscle that won't fire at all. And I'm going through clearing out other muscles that weren't firing in the right order, and I get them, but this one is stuck. And so I started asking through muscle testing what it's related to, and it turns out it's something emotional. So I ask her, hey, can you tell me what was going on around the time of the injury when it started? And she's like, oh, I was just at a volleyball meeting. And I was like, okay, yeah, but like what was happening, social, emotional stuff that was happening? Like what was going on with your girlfriends? What was going on at school? That kind of stuff. And she says, oh, I had like some things happen with a close friend, or who I thought was a close friend. And she just starts crying. And I was like, okay, I want you to think about that moment for a few minutes. I want you to like really picture that person in your mind. And I want you to remember how it felt, and I want you to incorporate how you're still feeling now about what happened. And then I want you to take that image. Do you have it in your mind? And she said yes. And I said, I want you to make it black and white. And she said, okay, I've done that. It's black and white. And I said, great. Make it tiny, like the size of a pencil eraser. And she said, okay, I'm doing that. And I said, great. This whole time this muscle's staying weak, but it's getting slightly stronger. And I said, now think about puppies. And instantly, she was stronger. Instantly. She literally went from not being able to hold her leg off the table when I lifted it for her to being able to hold her leg against me pushing on it with about 30 pounds of force. This is a 17-year-old girl, almost 17-year-old girl, who has chronic pain because we didn't address the whole person. Because inside the system with her insurance, the PT could only say, do these exercises and I'll see you next week. And they saw that PT for 6 visits, and she got worse the whole time she was there. When we start addressing what's happening in the nervous system, in the social emotional, and in the muscle directly, then we start making changes. That girl walked out of here today with no pain for the first time in 6 months, and a better understanding of how her core should fire. And we took all those high-level exercises out, and we went back to, this is what a post-surgery back patient would do, kind of exercises with her. And she was struggling even to do those, which means that there is no way on God's green earth she could have been appropriately engaging muscles to do the higher level exercises. Because of the hypermobility, we also talked about, because she's an athlete, appropriate protein intake and what that looks like, appropriate anti-inflammatory support because she's going to need it. We talked about collagen, and we talked about creatine as a supplement and support for her because long term she's going to need it. I think even just based on looking at her that we are going to push for her to get an official diagnosis of Ehlers-Danlos, just because I believe that there is also a cardiac component based on family history where the blood vessels are involved. As a PT, you may not be able to make a clinical diagnosis of something like Ehlers-Danlos, but you can certainly look at a person and tell whether or not they're hypermobile, and you should be having that conversation with them and what it could mean and know where to send them to get support. And if you don't, this is an area where you could take some continuing education for your license and learn something new that could help your clients long term. There is a surprising number of people who were hypermobile 20 years ago and were never told and now have severe joint arthritis and severe chronic pain. These patients become our chronic pain patients because they are mismanaged so much in their younger years. And I'm really glad that this girl was able to reach out to me and get the support that she needed before this became something that was permanent for her. I'm also glad that I understand enough the other side of it, the nutritional side of it, the supplement side of it, to be able to support her in that way so that she knows long term what she's going to be responsible for. We also had a conversation with Mom today about genetic testing and what that might look like and how we can support her whole system, not just one thing. And then we did the laser on her, and we had an entirely interesting conversation about red light therapy and what it actually does and what the research proves. It's kind of nice when you can see hope come back into a teenager's life, and great when you can see it come back into an adult's life too.